name is Neil Shaw, and I'm a sales engineer here at LinkMD. And today we have the pleasure of speaking with Dr. Akash Parekh. Again, today, for those of you who missed the first session, I'll go ahead and let Akash introduce himself.
Awesome. Nice to be back chatting with you, Neil, about another important topic in healthcare. As Neil mentioned, my name is Dr. Akash Parekh, and I'm a radiation oncologist by training and also one of the co-founders at LinkMD. I'm excited to be here and to chat about this next topic.
Awesome. So that said, today we're going to kind of get into the weeds of discussing CPT billing and revenue cycle management. So with that said, Akash, why don't you just provide a little bit of background as to what that is, and then from there we can kind of get a little deeper into the questions.
Yeah, absolutely. So it's an incredibly important topic. So CPT billing, or the acronym stands for Current Procedural Terminology Billing, is essentially the backbone of revenue cycle management in healthcare. It involves assigning specific codes to medical procedures and services that are provided to patients. These codes are used to communicate with insurance companies, and they ensure that healthcare providers are essentially reimbursed for their services. So accurate CPT billing is crucial because it directly impacts the cash flow and financial health of an organization. And if CPT codes are incorrect, the organization could face claim denials, underpayments, or even compliance issues, which can really disrupt the entire revenue cycle. So it seems like such a small component, but on the back end, it is a behemoth in terms of its importance and in terms of its complexity.
Gotcha. No, that makes sense. So now, what would you say are the common challenges, specifically around healthcare providers and what they face when it comes to CPT billing and coding per se?
Yeah, it's a great question. Some of the most common challenges, there's a couple, but some of the most common ones are one around the complexity and the volume of the code. So the
Mm,
CPT coding system is extensive with thousands of codes that are used to describe various medical procedures and services. Keeping up with code updates, any changes that are made, and new additions can be really challenging for healthcare providers and their staff. So just the complexity and volume of codes presents one of the most common challenges. Another one is sort of as a result of the complexity, another common challenge is coding errors. This is just mistakes in coding, incorrect code selection, upcoding, undercoding. These can all lead to claim denials, payment delays, audits. And the errors can occur because of misinterpretation of clinical documentation or just a lack of coding expertise, which then leads to sort of the next thing, which is documentation gaps. Another challenge is that accurate CPT billing really relies on comprehensive and precise clinical documentation. So having unclear
mm.
documentation can be really difficult for coders to select the correct CPT codes. And then if you add one final layer of complexity to this, is that each payer can have different rules for billing. And so navigating all the different insurance payers with different requirements and interpretations for CPT codes is also another layer of challenge.
Oh, wow. So, I mean, I know as you kind of get into the complexities of it, um, what would you say, or how does accurate CPT billing impact the financial health of healthcare organizations in general?
Yeah, I mean, I think as I sort of mentioned before, I'd say that accurate billing is at the very core of any healthcare organization's viability, both from a
Mhm.
revenue standpoint and, an analytics standpoint as well, in terms of obtaining data about where a healthcare system is moving in terms of the services it's providing.
Mhm.
So, you know, optimized revenue is one area where accurate billing really impacts the financial health of organizations. So accurate CPT billing ensures that healthcare providers receive the full reimbursement for the services that they're rendering. And
Mhm.
at a basic level, this will maximize revenue and support the financial stability of any organization. Um, the next area is that the more accurate your CPT billing is, the reduced number of denials and resubmissions you'll have, and
Mhm.
that in turn will reduce administrative costs that are associated with the resubmission. That'll in turn reduce burnout. That'll in turn reduce workforce turnover. And then, of course, reducing denials and resubmissions improves your cash flow because of faster reimbursement. So, those are all very intricately tied into the financial health. And one other
Mhm.
area that I'd just like to point out, Neil, is that another aspect of this is just patient relationships. So accurate billing on a practice end contributes to transparent and timely billing for a patient. And so by providing that accurate billing that's also transparent and timely, an organization can really enhance patient relationships, patient
Mhm.
satisfaction, and trust, which can lead to patient retention and positive financial outcomes.
I hear you. I mean, just, been a patient myself, and I feel like transparency when it comes to really billing and seeing what I'm charged for would truly make all the difference in the world. So that said, right, what are the most frequent errors or issues encountered when it comes to just say CPT billing in general?
It's a great question, and I think the mechanisms of these errors, as you're asking about, are really important to
Mhm.
understand. So maybe let's spend some time here. One general category is just incorrect coding or coding errors. This can take the form of an upcoding, which is when a provider or practice would use a CPT code that reflects a higher level of service or higher level of procedure than was actually
Mhm.
performed, which can lead to overbilling. And that can lead to penalties later on where a practice might have to repay an insurance company. Coding errors can lead to undercoding, which is what happens the exact opposite when you have a more complex procedure, but you bill for a less complex one. And
Mhm.
this can occur due to coding errors or just due to a lack of a detailed documentation, which leads to obviously underpayment. Um, Within that general category of coding errors, you can also have errors that just occur because you're not updated on the most recent changes that have occurred for CPT codes, which they occur more than you'd expect, which is frustrating to practices. Another area that I think is important to understand in terms of a very frequent error is modifiers. So modifiers are essentially used to provide additional information about a procedure or service. And if you don't apply the correct modifier or you don't use one when you should, it can also lead
Mhm.
to claim denials or improper reimbursements. Um, Another area that's really critical is insufficient documentation, as I kind of mentioned,
Okay.
which is that a claim can be denied if a CPT code that's submitted is not supported by the medical necessity that's documented in a patient's records. So a lot of these are probably some of the most common errors that are made in terms of CPT
Mhm.
billing.
Understood. So now, how do incorrect CPT codes affect reimbursement and revenue cycles specifically? And can you just provide some examples around how suboptimal billing practices have genuinely just led to overall revenue loss?
Yeah, absolutely. I think we touched on a decent number of these issues, but I think some numbers will probably help to put things into context. So,
Mhm.
the Office of the Inspector General reported, that improper payments to Medicare Part B because of coding errors were estimated about $3.3 billion in 2022, which is an incredible amount just from coding
Mhm.
errors. If other reports by the AMA say that, revenue cycle losses because of modifiers not being applied correctly range from about
Mhm.
5 to 10% per claim. So again, these aren't massive percentages when you think about 5 to 10%, but in the context of
Mhm.
hundreds of millions of dollars and hundreds of millions of claims per year, that's a lot, that ends up
Mhm.
adding up. And a great example, that I think that will make a little bit more sense to people is for example, a surgical practice. Modifiers are especially important for surgical practices or a procedural specialist because it'll basically modify the more generic CPT code to something that's more specific to what the proceduralist actually did. But if you
Mhm.
don't apply that proper modifier, you're not billing appropriately and you're probably getting underpaid. Another example is something that commonly occurs for proceduralists involving bundling or unbundling. So the basic concept is that you might have one primary procedure that you did, but you're going to have other ancillary CPT codes that you should be billing for. So
Hmm.
if you bundle all of those into one CPT code instead of individually billing for those services, you're losing revenue. And that's just a matter of knowing, what services you can bill for separately, which ones you cannot bill for separately. But these are all, very important aspects
Hmm.
of any practice being able to be financially viable.
Gotcha. And as you kind of talk about the scale of this issue, how can technology and automation assist in optimizing CPT billing processes? And then how can integration with different EMRs per se and payer portals enhance this from an end-to-end methodology?
Yeah, I mean, that's a great question. I think this area, Neil, is incredibly ripe for
Hmm.
automation and technology. I think all these issues that we've talked about so far, and there's many more. They're going to demand a more streamlined way to engage
Hmm.
with billing, and technology is going to play a really important role. So one of them is going to be automated code selection. So I think the lowest hanging fruit is um, automated coding tools that can analyze clinical documentation and suggest the most appropriate CPT codes based on the services that were provided. So this, again, will reduce the likelihood of coding errors such as upcoding or undercoding and can just
Hmm.
ensure accurate billing. Another area is, what I'd like to call real-time code validation. So these automated systems can validate CPT codes in real time against
Hmm.
payer-specific rules and guidelines. So as I mentioned, payers have different guidelines for their billing, and having a real-time code validation can help identify errors before the claims are submitted, which will reduce the
Okay.
chance of having a claim denial, or rejection.
Hmm.
Um, Another aspect of this, should the denial occur, is automating the denial management. So, if you had an automated way to sort of streamline um, and categorize and track these denied claims, and suggest the corrective action
Hmm.
automatically, that'll reduce the turnaround time for resubmissions and revenue recovery, and also reduce administrative burden and provide more timely care for patients.
Hmm.
And to sort of draw upon our last conversation, Neil, um, you know, claim denials cost hospitals about $20 billion a year. So this
Hmm.
is not an insignificant amount of money. So, those are all ways that technology will really play a big role in streamlining this process. I would say from a sort of data analytics standpoint, having an accurate billing system along with a way to accurately dissect out clinical documentation to support that
Hmm.
system will support any advanced analytics platform, because a hospital or a practice can then use a very data driven approach to
Hmm.
make informed decisions about the services that are going to be in high demand, maybe coming up, services that are typically in high demand, services that are chronically denied. This is
Hmm.
critical information from a financial planning standpoint for any organization.
Yeah, I mean, it makes sense, right? Like when a hospital were to set up that ecosystem of technology, it's only going to enhance that data-driven process when it comes to really gaining some of these insights based off automation entirely. And then that said, I also wanted
Absolutely.
to kind of touch up on the second half of that question, right? So, can you talk to me a little bit about how integration with specific EMRs and payer portals can actually enhance the overall efficiency when it comes to the process of CPT billing?
Yeah, absolutely, absolutely. And that's going to be a critical component of any sort of
Hmm.
technological system that would be integrated to do this. So if a system can automatically integrate into an electronic health record to pull the clinical data um,
Hmm.
directly, it can use that data that sits in the electronic health record and then seamlessly work into a billing workflow that makes sure that all relevant services are captured from the electronic health record, which serves as the
Okay.
sort of hub for the documentation. So, by pulling directly from the EMR, the billing system can really ensure that the information that's being used for CPT coding is consistent, it's up to date. This will reduce discrepancies that can occur between clinical documentation and billing, which is again a common cause of denials. And
Hmm.
then these integrated systems can really automatically check CPT codes against these payer-specific rules. So having all that into one ecosystem before submission even occurs reduces so many of the problems
Hmm.
that result from CPT billing that we've already discussed. But that integration is a critical component because patient-specific information sits within that EHR.
Gotcha. And now I want to kind of touch upon microservices, right? And what are the key benefits of using these microservices when it comes to billing optimization around these CPT codes?
Yeah, absolutely. I guess, we should start back from what I guess a microservice architecture is. And it's
Hmm.
essentially a software development approach where applications are composed of, at a most basic level, small independent services that can communicate with each other through
Hmm.
APIs. And so there's this sort of architecture offers several benefits for billing optimization around CPT codes in particular. Some of these are scalability, flexibility, and modularity. So, scalability, a microservice can allow for the individual components of the billing system. So whether that's the code validation, a claim submission, denial management, all of those three
Hmm.
things can be scaled independently depending on a practice's needs. So this can really ensure that the system can handle increased workloads and it can be tailored to a particular practice. In terms of flexibility and modularity, because each service has its own specific function, it's easier to update, replace, add new features. And this is incredibly important for CPT billing since we've already talked about how these codes are constantly being updated
Hmm.
or payers are changing their rules, right? So let's say in a situation where the codes actually change or there's a new modifier, maybe you want to just update the new codes and that'll be the within that microservice, or maybe it is the payer that has changed its rules and so you want to update that specific claim submission process for that payer. So that flexibility and modularity really helps organizations adapt to
Hmm.
whatever these guidelines are. And another thing is, you know, with microservices, security measures are much more easily applied to individual services that just reduce the risk of, one single vulnerability compromising the entire
Hmm.
system. So just in terms of healthcare being so um, critical for the EHR data being so critical for privacy, this is really important in terms of protecting sensitive billing information and patient data. So I think having a microservice is a really critical sort of component of building out a system like this.
Hmm. Gotcha. And now, given the challenges in CPT billing, how do you think a solution like LinkMD can help address some of these issues? And how do you really envision LinkMD's billing optimization tools to improve the overall revenue cycle management workflow?
Yeah, absolutely. I think LinkMD's solution is a really elegant and seamless microservice that can help optimize revenue capture. And Um, for a lot of the reasons that we just talked about in terms of the microservice,
Hmm.
it can sit inside the EMR or it can sit outside the EMR depending on a clinic's preference. So it can be customized. For CPT billing, especially in procedurally focused specialties, it utilizes the information from the encounter in a patient's clinical note and then
Hmm.
also the most up-to-date specialty coding guidelines, and then can accurately predict all the appropriate billing codes that need to be associated with a given encounter. Um, I mean, it basically, if the most whatever you want to dream up is what it can do in terms of that.
Hmm.
So being able to predict the appropriate billing codes is critical because then you're capturing everything you need to. And it goes even one step further because it can provide suggestions about how to optimize documentation to then support the billing. Um, on the back end, the best part is that it's fine-tuned on prior successful documentation and CPT billing. And so as new coding outputs are generated and we have results, of what the insurance company said about acceptance or denial, we're able to fine tune the system itself. So the impacts of this are so multifaceted. Accurate billing will prevent over and underbilling. It'll, prevent inappropriate bundling. It'll suggest appropriate bundling. And,
Hmm.
there's less chance that you'll have denials. You'll have faster turnarounds. And those are just a couple examples of how this technology can help with revenue cycle management. I would say in a bigger healthcare context, it also really reduces administrative burden for billers
Hmm.
who do a lot of this work manually. And they have to rely on having the most up-to-date coding guidelines. They need to keep track of different billing procedures per the
Hmm.
individual payer. And because the microservice can suggest how to optimize a clinical note in terms of documentation, it also can serve as a co-pilot to physicians who don't have time to keep up with the new documentation requirements to support a
Hmm.
particular CPT code. I know personally I don't, and I only realize that on the back end, my biller says to me, "Oh, you need to go back and add XYZ into your note," and I'm wondering, when did this change? So for all of those reasons, I think that LinkMD's solution is elegant and seamless.
Gotcha. And then with that said, what specific features of LinkMD's platform would you find most valuable for optimizing just CPT billing in general?
Yeah, I think it's a good question. I think
Mm.
all of the features are great that I mentioned, but I'd say probably that some of the most important aspects are the ability to accurately predict a comprehensive list of CPT codes based on a patient's clinical encounter
Hmm.
is truly one of the most important um, and valuable aspects. And I'd say the other one that's very important is the model's feedback loop that helps to
Hmm.
fine tune itself and therefore be customized to a particular clinic and a particular specialty. And I think those two aspects are going to be really important, both from a revenue capture standpoint and from a reduction in administrative burden. Of course, like I mentioned, I think the co-pilot for physicians is going to be really important as well in terms of documentation and some of the other features that I talked about. But I'd say these two that I mentioned are really critical.
Gotcha. And thanks for that insight, Akash. It truly does help. And with that says, as we kind of wrap this up, looking ahead, what are your predictions for the future of prior authorization and CPT billing optimization in the healthcare industry?
Yeah, I think we're really living in a time of I truly, like, I don't understate it, of a new revolution when it comes to
Mm.
AI's impact on every aspect of our lives. And then focusing more on healthcare, I think AI tools will really continue to grow in relevance and importance over the
Hmm.
next 5 to 10 years in all aspects of healthcare, whether that's in diagnostics, therapeutics, or as we're talking about today on the administrative side. I think from the administrative aspect, it's truly going to be a game changer. I think it'll
Hmm.
change the speed and agility with which organizations and can administer healthcare, just being able to do it faster. I think it'll reduce burnout among providers at a time when many trained providers, which
Hmm.
we have invested hundreds of thousands of dollars in training, and who have themselves have spent many years getting this very important knowledge, they're leaving healthcare due to exhaustion and how cumbersome healthcare delivery is, and so it'll help reduce that at this
Hmm.
very critical time. And I think hospitals and practices already are looking for services like LinkMDs to incorporate into their clinical workflows because they're low hanging fruit with incredibly outsized impact on the financial viability of any practice. And so I think any practice that's looking to grow long term will have to adopt advanced technologies like LinkMDs to stay
Hmm.
competitive and to improve patient care and improve patient satisfaction. These are pretty big statements, but we'll see whether some of these predictions come true. But I feel pretty confident that we're going to see a true 180 in healthcare over the next 10 years because of AI.
Mhm. I couldn't agree more. And I know we're running out of time for today. So, Dr. Parikh, thank you so much for taking the time and providing all the insight you have provided today, right? And with that said, if anybody has any questions, feel free to reach out to myself or even Dr. Parikh for that matter.
Absolutely, so glad to be here and to talk about this very important topic in healthcare, and excited to chat with you again. Whenever.
Awesome. Thank you.